Hey, Dr. Kyle Konis here, and I just want to take a little bit to educate you here on the TheraLight 360 Plus that we have here. Now, this uses red light therapy and infrared light therapy. This is some of the most research-based therapy you can find anywhere in healthcare. There are over 4,000 studies done at this point and over 500 clinical controlled trials showing that this can help the body heal. It can help with a variety of conditions. Now, the cool thing about this uses, like I said, red light therapy and infrared light therapy. And these very specific wavelengths that the TheraLight 360 uses actually gets absorbed by the cells. Inside the cell, we have something called the mitochondria. These are known as the powerhouses of the cell, and it's what actually creates energy. And so what's cool about this is the light is absorbed, and then the cell can actually create more energy and actually heal itself if it's had any damage, or create energy for the rest of the body. Another cool byproduct of that is that it can also create nitric oxide. Nitric oxide can help our body heal, and it actually opens up blood vessels so that we can get increased blood flow and help with circulation. So some of the benefits you'll see on here that have been shown in research is to increase energy, decrease pain and inflammation, increase circulation, and actually increase skin tone and clarity. It does that because we get increased collagen and elastin production in the skin when we use this therapy. So if you're somebody who's looking for the extra edge, maybe if you're someone who's sick of dealing with the aches and pains, maybe you have joint pain, maybe you have skin issues, maybe you're someone who's just, hey, I want to slow down that aging process and I want to make sure my cells stay healthier for longer. Well, this could be a therapy to check out, and the TheraLight 360 Plus is the best available on the market, which is why we use it. So if you're someone who's interested in that, we look forward to talking to you soon.